Okay, amazing calf pro backers. This value add update is about alignment, and we're going to tie in hamstring tension with that. There are actually 12 tension spots in the body. Calf Pro deals with one tension spot, and we worked on tension last week in the medial compartment. This week we're going to work on tension in the hamstring in association with alignment of the leg. So in terms of alignment, what I want you guys to know in terms of lower limb pathology is that although there are many alignment issues, the one that's probably most relevant to us as a community is medial rotation and pronation. So if we pick a leg, pick my left leg, when I'm talking about medial rotation, I'm talking about the knee falling in. And it's almost screwing down. That's the problem, because the arch collapses or the ankle falls in and the knee falls in. And this is the primary cause of problems in the leg. So it's a turning in of the hip, a falling in of the arch of the foot, and the knee just goes along for the ride. The knee's a hinge in between. It just wants to hinge and it just wants to do this. And if your hip's falling in or your foot is collapsing, the knee becomes damaged. So we have to deal with alignment of the hip and foot in order to bring the knee out. And I'm on the side of saying that if you can turn your knee out more, that's good. More knee turn out, more arch lift, more external rotation of the hip is good. Okay, so then how do we get that? The first thing is footwear and orthotics. So I'm wearing a very built up shoe on purpose, and I have a very built up orthotic inside, which I made myself because I make custom orthotics, but you don't need mine. You can get anything, or you can even just get a shoe that lifts you on the inside. This is the point. So a pronation control shoe will really help. If you're a supinator, then this is not relevant, but I can tell you that 80% of the people I see with a foot and ankle problem, maybe 90%, have some sort of medial collapse pronation component to their problem. If you stand on the outside of your heel, this isn't necessarily for you. But most of you are going to have some sort of medial collapse, because that is the sort of problem that we face, I think, primarily in the decline of our bodies from sitting and not being necessarily strong or fit enough and not stretching enough. We deal with the medial collapse usually. So you want a shoe that lifts you, and we want to work on stretching and strengthening the hip. One thing that everybody's been talking about or asking for was hamstring. So I'm going to tie in hamstring as the second stretch of the body in conjunction with alignment. So we're talking about lifting and opening up the inside of your knees and the feet and the hips. So let's also look at a hamstring stretch that you can do. So in theme with the treatment technique that we've been discussing, we always do tension release on the structure that we're discussing. So today we're discussing hamstring, and tension release with the hamstring. Again, you take your foam roller or you take your hands, you put pressure on the structure that may or may not be tight, and you can even add weight from the other leg, and we're rolling and we're looking, so about there, for something that hurts. Tension hurts, so we're looking for something that hurts. That hurts, it actually refers into my knee. If something shoots somewhere, that's a good spot. And then we are stretching that spot, because the medial, and notice I'm going on the inside of my hamstring, more or less like almost on the groin, because the medial hamstring, when tight, can influence medial rotation of the leg and hence drop you onto the inside of your heel or affect your Achilles or the forefoot or the navicular or all the big toe joint. All of these places that get damaged, we tend to see a lot of damage on the inside of the foot. Okay, so we've foam rolled, and then the rule is we immediately go and stretch the structure that we foam rolled or trigger pointed. So hands are on the wall for this one. We're propping like we're in a lunge position, then we lock the side that we foam rolled, and we're keeping our back flat and our toes are up, and we're adding a stretch in that direction, and then we'll even turn the hips towards the side we foam rolled and get a nice deep stretch. In a sense, we're opening the knee, so we're seeing how we're tying in alignment with hamstring release and stretching and improving range of motion, and that will give us a nice more open position to open up the arch, the knee, and the hip joint. Thank you so much, guys.